All right, gang, I'm on to the post-event massage. This is going to be a little slower, a little longer, all right? Not invigorating, but more relaxing, all right? It should not be painful because the athlete has already gone through the event and they've already experienced some pain, so you're trying to push blood tactile to the skin for gating of the nervous system, all right, and just get them to relax. Part of this is also doing some stretching of the muscles, some mob of the muscles, or mob of the joint, and I usually like to start with a mob technique of some oscillations to just really relax the extremities. So I'm going to show you those. So this is the Maitland oscillation technique, and you can do it in multiple ways, but usually I just oscillate the legs for about a minute to 2 minutes each. So here's the I'm going to start with the oscillations. All right, so I'm going to get the leg to relax. I'm going to close, open pack it, so the hip is going to be a little bit externally rotated. All right, and then I'm just going to lean back, and I'm going to do 1 to 2 oscillations. I can make sure that I'm not pinching the skin, and I can hold the ankle in a way that I can oscillate on the ankle joint also. So I'm going to oscillate here 1 or 2 oscillations per second, slowly back and forth. You can lift it up, you can bring it down, you can get them to the side of the table a little bit more, all right, and just oscillate. It's amazing after some sort of competition how this minor oscillation seems to relax the area. I do have the leg a little bit elevated, all right. So I am pulling on the joint, so I got some proprioceptors firing when I do this, all right. So you start out with the oscillations. Then you can start out with the jostling, okay. So you have a series of muscles down below here, anterior tib in the front. So I'm taking and I'm trying to oscillate that with a little compression to that tibialis anterior. All right, so the whole leg is moving, but I have some compression on the tibialis anterior. All right, and then you do that until you feel like it's enough, and then you move up. Okay, and then you have the quadriceps. And this can be done over the clothing. You do not have to have the person remove any clothing for jostling or oscillations. All right, so you get this compression. You can take the different muscle areas and jostle. So I'm kind of pushing on the lateralis and the tensor fasciae latae, just jostling this hip, and the whole leg will oscillate. All right, so that's jostling. All right, then you can do a couple of different things. In the prone position, all right, you can start with some static stretching. All right, so you are going to stretch, obviously you start below and you can stretch on the anterior tib, and you can do a little pin. You compress and then stretch that, compress, stretch. Okay, so there's the tibialis anterior. So you're pushing in, you can use your forearm to push in and stretch. So that's called pin and stretch. All right, then you can do the gastrocs, and again we'll do the pin and stretch on the or do the pinning when we put him in the prone position. But go ahead and do the gastrocs, and you can do the soleus, just some simple static stretching. Okay, now this patient is not tight because she hasn't been running, but as you do that, you can feel it tight, and then you can feel it release. Most release will happen somewhere between 6 and 20 seconds. So a static hold, all right, and then hamstrings, all right, and you can do also the hamstrings and the groin at the same time. Okay, you can do them separately, all right, but this is to get the muscle to release from tightness. All right, then before you roll, and then you're going to do one leg, then the other, and then you finish with some sort of efforage. Okay, and that would be whichever, if you follow the list here, that would be your post-event massage, and then I would roll her over. I'd do both legs supine, and then both legs prone. Why do you start post-event supine? Because they've already been breathing hard, and they have a hard time breathing when you lay them on their stomach. So if you take 10 minutes here, all right, or 5 minutes here, their breathing will be better this way. If they're all sweaty and have a hard time breathing, you lay them prone, they'll have even more hard time breathing. So give them a little bit of time, do supine first. All right, so I went through the steps. You can organize it how you want, but this is an outline for you to use. All right.